Good evening and welcome to Montgomery Heart Wellness. I'm bringing you a late Saturday evening discussion. We're going to talk about the inside skinny on fatty liver disease. So fatty liver is a very important topic. I see lots of patients coming to my cardiology practice who've been diagnosed with fatty liver. And it's something that's very common. It's the most common cause of people needing liver transplants. And tonight I'm going to share with you some of the basics on fatty liver, number one. And number two, I'm going to talk about what you can do about it if you've been diagnosed with fatty liver or have a loved one who's been diagnosed with fatty liver. But also, I'm going to share with you the connection between fatty liver and dementia. Oftentimes, people are diagnosed with dementia, but it's my theory they have underlying liver issues. So we're going to talk about those things. So hold on. At the very end, I'm going to share this connection between fatty liver and dementia. So let's talk about this whole concept of fatty liver. And what I'm going to do is change my slides around and go to the beginning so I can get you started. But the whole concept of fatty liver is one that's, I would say, that's relatively new. And the reason I say that, if you go back 10 years ago, definitely 20 years ago, most doctors weren't thinking of fatty liver the way we are now. And I still think a lot of doctors are not really in tune with the concept of fatty liver and how underlying liver disease contribute to lots of other chronic illnesses and impairments. So here's what you need to know about fatty liver. Now, with any chronic illness, you have to understand the underlying process. I like to understand disease, chronic illnesses based on the underlying mechanism. Mechanism number one, inflammation. Inflammation underscores virtually every chronic illness, cancer, neurological diseases, metabolic disorders, heart disease, underlying mechanisms, inflammation. So inflammation is going to be at the heart of it. The number two mechanism is going to be oxidative stress. Now, what is oxidative stress? If inflammation is like a biochemical fire, oxidative stress is like a toxic chemical buildup. So just think, if you're building up toxic chemicals in your body, and your body's not able to rid itself of these toxic chemicals, internally it can cause lots of damage. And so we refer to them as free radicals. Free radicals are unstable molecules that fly around. They are missing an electron, and so that makes them unstable. So they fly around, they damage cell membranes, they damage DNA, they damage other parts of the cell, so they cause the cell to break down. If you've ever sliced an apple and watch it sit on a counter, and you watch it turn brown, that's a sign of oxidative stress or increased oxidation. So that apple is oxidizing. Next, and the third mechanism, which is probably the underlying process of all of these mechanisms, is a dysfunctional microbiome. Our body is an ecosystem. We have lots of microorganisms that live in and around us. And the biggest collection of these microorganisms is inside our GI tract. And so if you have a disorganization, bad bacteria overgrowth, a fungus overgrowth, it can lead to what's called leaky gut syndrome. It tears down the inner lining of the gut and breaks it down, and it causes toxins to leak across and get into the bloodstream. So these three mechanisms are really important to underscore chronic illness in general, and especially liver disease in particular. So if you start with inflammation of the liver cells, it's a common trigger. And so what happens is the main driver in terms of the hepatocytes or the liver cells, and the main driver in liver cell damage is inflammation. It then leads to progression of fat, non-alcoholic steatohepatitis, with fatty liver, and then scarring of fibrosis, and then in some cases, cancer. So if you have inflammation, and that inflammation is an ongoing driving process, it's pushing the whole process towards scarred down liver, and in some cases, cancer. So you want to shut that process off. Non-alcoholic fatty liver, also known as non-alcoholic fatty liver disease, We refer to it as NASH, non-alcoholic steatohepatitis. Is a fancy medical term. Just remember NASH is a fatty liver. It's characterized by the accumulation of fat in the liver. Now, most people think, well, if I eat a lot of fat, that's why my liver's fat. That's not necessarily true. Yes, if you eat a lot of fatty foods that have a lot of trans fats, these trans fats are biochemically toxic. But there are other sources of substances, food or non-foods, that are also biochemically toxic. Animal protein is biochemically toxic. Many drugs that are cleared through the liver is biochemically toxic. So fat accumulation will happen whether you're consuming lots of fat or some other kind of toxin. Processed sugars is another example. It's estimated about anywhere from 10 to 35% of the world population is affected by this disorder. It's an independently associated increased risk for heart disease and increased mortality. And also 27% of the people with NASH eats 27% more meat compared to the general population. So meat consumption is a big contributor to this. What are some of the other common inflammatory triggers? Well, first and foremost, you're going to have the poor diet, as I alluded to. Animal protein, processed carbohydrates, food preservatives. You eat lots of things out of cans and boxes. If you look at the foods, and if they have these long lists of preservatives and things that you can't pronounce, that's likely to contribute. That the liver has to process, or the liver works as two major functions of the liver. It's a manufacturer. It manufactures proteins for enzymes and manufactures antibodies, but it also stabilizes or neutralizes toxins that comes through the bloodstream. So it has that important role. So if you overload it with these toxins, it's working overtime. Excess number of medications, statin drugs, antihypertensive drugs, psychotic drugs. Lots of people are on antipsychotic drugs for sleep and depression, etc. We're going to share with you later on how that might be counterproductive if you have liver disease. Pain relievers, Tylenol. And of course, there are many other drugs, too numerous to count here. Systemic infection, pneumonia, leaky gut, urinary tract infection. These things can contribute as inflammatory triggers to then have an effect on the liver. Systemic inflammation, lots of people with autoimmune diseases, lupus and Sjogren's disease and other types of autoimmune diseases, it can also affect the liver. And of course, the reaction to drugs. Many of you are familiar with that with vaccines, perhaps. And of course, cancer. You can have a local cancer that has a local reaction that has a secondary systemic effect. And then when the cancer spread, even if it doesn't spread to the liver, spread throughout the body triggers systemic inflammation that can have an adverse effect on the liver. And also the treatment of a lot of these illnesses utilizes drugs. So you get back to the medications. If you're treating cancer, a lot of the chemotherapies have an adverse impact on the liver, and antibiotics and other things that you're treating can have an adverse effect on the liver. So it's sort of a double whammy. So the progression of NASH, you have an inflammatory insult, fat infiltration of the liver cells. These are the cells that are reacting to inflammation. It's trying to protect itself. It's trying to put these toxins away. So think of the fat cells as dumpsters. You have mitochondrial disruption. Now, that word mitochondrial disruption is a fancy phrase. Mitochondria, just remember that term, mitochondria are the cell's battery. If the mitochondria in the cell is not working right, the cell has low energy. Mitochondria is important for many things. There are two major ones that are important for this discussion. One, it's important to keep the cell energized, the charge. It produces ATP. Two, it helps maintain a stable biochemical environment for the protein, keeps oxidative, antioxidant stress in balance. So if the mitochondria wears down, you have increased oxidative stress. That's these increased biochemical, toxic waste chemical substances that builds up in the cell, and the cell doesn't make energy. So it's like your cell's battery is turning off. If you have like a little toy that's batteries wearing out, the toy just sort of slows up and wears out. Liver fibrosis leads to scarring and cirrhosis of the liver itself. Fatty liver cells release inflammatory mediators. So the liver gets insulted with inflammation. It has fatty buildup, the inflammatory markers, and these fat cells build up till they start to leak and explode, and then it releases out into the bloodstream, and it causes more inflammation throughout. And this ammonia metabolism. Now, I want you to keep this in mind, because this is going to connect to my final comment about how NASH connects with dementia. And anti-inflammatory molecules are reduced, so we don't produce molecules that decrease inflammation. So just to give you a picture diagram, you have a normal liver here, and you have increased inflammation, and it causes fat buildup in the liver, so you have non-alcoholic fatty liver. Then the fat cells start to release inflammation within the liver itself, so you have liver toxic factor. Then you have NASH, non-alcoholic steatohepatitis. That means the liver cells become dysfunctional, and then you have more advanced scarring and fibrosis to the point you get cirrhosis. You can have another image here that could show liver cancer. So this process can be halted or pushed in the other direction and almost at any time. Now, obviously, you get too far, it becomes more difficult. So the farther along you go here, the more difficult it becomes to change the process. So how do we change it? What's the treatment? There's some simple things you can do. Proper nutrition. If there's ever some guy that comes on this channel, looks like me, and don't talk about nutrition as a key source for chronic illness, and you got to know there's an imposter. But you want to remove all the animal protein. You want to remove overly processed foods, the processed sugars, etc. You want to consume a high amount of raw plant-based foods. Our patients we have that come in with advanced liver issues, we will put them on like a juice feast, super greens, time-restricted eating. We do that to help clean the liver out. We've gotten good success with that. You want to eliminate medications. Obviously, talk to your doctor. Get them to help you wean these toxic medications off. Help them get you to avoid taking new toxic medications and minimize overall medication count. So that even if they're drugs that are not cleared through the liver, they may increase the levels of drugs that are cleared by the liver. So drug-drug interaction can play a role. Even though you may have a drug that's not cleared by the liver, you may want to just get rid of that too. The fewer the medications, the better. Targeted supplements. Many of you probably know some of these things: omega-3 fatty acids, N-acetylcholine, milk thistle, turmeric. I'll do a talk when we talk about how we address fatty liver and touch base on some of these things. And at our center, we do some advanced therapies such as ozone infusion. Ozone is a very, very powerful antioxidant. It works very well and synergistically with the raw detox diet. We also use phosphatidylcholine infusions as a liver detox, and we've had some good results with that in that context. Now, N-acetylcholine is one that can also be done as an infusion as well. Now, what is this whole issue of dementia and non-alcoholic steatohepatitis or fatty liver? It is my theory, write this down, it's my theory that a large percentage of people who are diagnosed with dementia have dementia primarily due to an underlying liver dysfunction as opposed to a primary brain dysfunction. Let me say that again. A large percentage of people who are diagnosed with dementia or cognitive decline have such due to an underlying liver dysfunction as opposed to a primary brain dysfunction. Now, it doesn't mean that they all have fatty liver, but liver dysfunction can occur outside of an imaging study that shows you have fatty liver. Liver dysfunction can occur even if you have normal liver enzymes. And so you can have abnormal hepatocytes. Hepatocytes are the liver cells, so they can be functioning abnormally. And so this is why you're having dysfunction of the liver. So what are the dementia-like symptoms for non-alcoholic liver disease? Inattentiveness, brain fog, impairment of memory, abnormal sleep cycles, tremor, myoclonus, confusion, stupor, and coma. This is advanced liver disease. Now, these are all symptoms of, in what's called hepatic encephalopathy. But there's an overlap of hepatic encephalopathy and dementia. And so this diagram here, I'm going to go through it with you, is really critical. Now, I'm going to do a small talk on another show to connect this a little bit more, but I want to give you something to start with. And so you have in the GI tract, so if you're consuming ammonia-rich foods, so nitrogen-rich foods, that ammonia goes to the liver. Now, if you have a normally functioning liver, like here, that ammonia gets converted to urea, and that urea gets released through the urinary tract. So if you've ever looked at your blood lab test, like a comprehensive metabolic panel, your basic metabolic panel, you'll see a lab called BUN, capital BUN. That stands for blood urea nitrogen. If you're a heavy meat eater, that blood urea nitrogen number will be high. It'll be in double digits, maybe 15, 20, whatever. If you are on a strict plant-based diet, that number may be small because plant foods don't give the ammonia load that animal protein does. Now, if the liver is fatty or cirrhotic, you don't convert all that ammonia to urea, and that ammonia stays in the bloodstream. Now, ammonia could be a neurotoxin, so it goes up to the brain and it has an effect on your astrocyte cells, causing them to swell and burst, and you have mitochondrial dysfunction in your brain. Now, as I said before, mitochondria are the batteries of your cell. So just think about your brain batteries. If your brain batteries are worn out or dysfunctional, then just think you start to think slowly and you talk slowly. You can't remember anything because the brain doesn't function normally. So that's one of the signs of dysfunctional nervous cells is mitochondrial dysfunction in the brain cells. These cells start to become swollen. They can burst. You have neuronal damage. I'm going to go into this a little bit more detail when I talk about the connection between liver disease and nerve damage. But you can have reversible and irreversible changes in the brain. So a lot of people with fatty liver and liver dysfunction and early cirrhosis tend to have dementia-like symptoms, and many of them may be diagnosed with dementia and get put on dementia drugs, which have an adverse effect on the liver. And some of these neurological symptoms can mimic seizure-like activities, and then you may get put on a seizure medication. Now, I'm not trying to make diagnoses and tell you what to do and what not to do. I want you to understand the principles here. And when you talk to your doctors, your healthcare practitioners, share this insight and ask key questions. Look up some of this stuff for yourself. Don't just take my word for it. So anyway, that's the issue that we're dealing with. A clean liver leads to a clear mind. Keep in mind what we eat affects us not only in the GI tract, the liver, the brain. These organs are all connected. And I'm going to bring some other talks to you really soon and go over how this is connected in a more detailed fashion. It's very important information. And I hope you got a lot of this today. If you did, give us a thumbs up. And of course, share this with loved ones and anyone you think can benefit from this. And of course, if you're new to the channel, please subscribe. You'll get lots of more information like this. And as I said before, Clinical Rounds is on its way back. So y'all stay tuned. So